Hi guys, welcome back. We're going to talk about anatomical terms. This lesson, your learning objective for it is I will be able to use the anatomical terms to describe the position of the body and objects within that body. Okay, the first thing we're going to talk about is anatomical position. This is just the starting point or your home base. So that way when you look at the body, we have a clear communication. So anatomical position is a erect standing position with his arms out the sides and palms facing forward. This guy's kind of small, but this guy is in anatomical position. If you look at his arm, his palms are facing up. He's standing pretty relaxed. And when we're talking about left and right, if you split him down the middle, right here, we will assume that each side, which can be confusing if you're looking at a picture. So this side is the left side and this side is the right side. Alright, the next thing we're going to talk about before we get into some of those other anatomical terms is body planes. This is a hypothetical geometric plane used to divide your body into sections when there are 3 of them. So when we place things using those anatomical terms, we need to make sure we are talking about them in the right plane of body. So the first one is our sagittal plane. Down here it is red. You also have a picture of this on your guided notes. Your sagittal is the invisible vertical flat surface that divides the body into left and right. So again, left is over here and right is on this side. Your frontal or your cornell plane is this blue plane that you have down here. This is the vertical flat surface that divides the body into front and back, or anterior and posterior, which we will talk about here in just a minute. And then your last one is your transverse plane, and down in your diagram, it's your green one. It is the flat surface that divides your body into top and bottom. All right, we're going to get into those directional terms now. There are a few of them. All right, so here's our diagram. You also have a diagram guide on your guided notes. So directional terms are words that describe the location in a body. So superior or cranial means closer to the head. If you look here, they use superior or cranial. And on this one, they use superior, closer to the head. Inferior, down here. Or caudal, which means away from the head. So my shoulder is superior to my fingers. Anterior means towards the front of the body. So the front half of your body. And then posterior means towards the back, so the back half of your body. And then you can split your body straight down the center and make it completely even. This is called medial. It's the middle line of your body. It's where your sternum lives. And then lateral is away from the middle of the body. So anything that goes towards your center is medial, and anything that goes out is lateral. All right, the next few are your proximal, which is closer to your trunk, which, if you look right here on this girl's arm, it goes up. So your shoulder is proximal to your trunk than your phalanges are. Your trunk is just the main part of your body that contains your chest, abdomen, pelvis, and back. So this area right here is considered your trunk. Your distal is away from the trunk, so again, your phalanges are distal compared to the rest of your body. Superficial means towards the surface of the body. So you hear this when we talk about wounds. You have a superficial wound, it's pretty on the top layer. And then you have a deep wound, it's like in your muscles and goes in towards in your body. And then the last thing is how we section cylindrical organs. So we have some of those. You have a cross section which just cuts across the structure. An oblique section, which is an angular cut. So if you think about math, an oblique line is angular, and then longitudinal is cutting it lengthways, so like straight up and down. Those are all the terms that we will get practice in and using when it comes to talking about our bodies. Thanks, guys.